So about that patient that had intractable seizures, what she took was isoniazid, INH. So INH actually causes a functional deficiency in vitamin B6 and GABA. And GABA is the neurotransmitter that causes things to kind of calm down. So you can see that if you don't have that, it causes things to be super excited, which is essentially what a seizure is. So the treatment for that is vitamin B6, which is pyridoxine. And honestly, seizures respond to this in minutes, 5 minutes sometimes less, sometimes a little more, but it's very quick. So giving her the vitamin B6 really did prove, and with her seizure stopping after the administration of vitamin B6, really led us to go back to the family and say, well, what's really going on? I mean, it looks like she probably took this. So then at that time, they came clean. See, INH is used to treat tuberculosis. In parts of our country, having tuberculosis, treating tuberculosis is a very stigmatized thing to do. So a lot of times people who have people in their homes that are being treated for tuberculosis, they may try to keep that a secret. They may try to keep that personal. And in so doing, when the family came to the emergency department and were interrogating them about, well, what drugs are at the house? What medications did she have access to? They were very concerned about sharing the fact that INH is in the house, because that would necessarily mean in their mind that somebody had tuberculosis, and therefore it would set off a sequence of events which may cause authorities to show up at their house because of the diagnosis of tuberculosis with someone in the house. So basically that's what she did. She tried to overdose by taking the INH and had intractable seizures that the treating team was having a hard time controlling. They had tried the standard mechanisms because the history was not revealing access to INH. But by the time they called me at the Poison Control Center, I was able to kind of say, well, this is a very safe, possibly effective, but if it doesn't work, it doesn't hurt her. So let's try this. And when the seizure stopped, we had our diagnosis.